He's already lost about a litre of blood. The human body contains 5. Adam knows he can't afford to lose much more before he passes out and goes into cardiac arrest. The graveyard is huge, and there's no sign of the crew or the patient. That wound has gone so deep, his bowel is now protruding out of his abdomen. Ravi suspects the knife has punctured his patient's lung, a potentially fatal condition that could cause respiratory failure.
You should see the cyclist just coming down there.
Okay.
Hello, ambulance service. Is the patient breathing?
Yes.
Are they awake? Are they conscious?
I don't know. It's my husband. He's just said he needs help. I don't
Okay,
know
are they awake? Are they conscious?
Yeah, he was. I've
And
lost him now.
What's the
Off
reason for the
phone.
call?
He's fell through a floor. He's on Old Farm and he's on his own.
Okay, what's the address of the emergency?
All I've got is it's like a derelict farm.
What's his name?
Neil,
And how old's Neil?
63.
Leave it with me and I will try and ring him and I'll find out where he is. We've got the help arranged.
With reports of a serious accident in a remote rural location, Helimed 03 is scrambled.
A 3-year-old male, he's had a fall from height, approximately 12 feet. Injury to the head and the back appears to be quite a lot. Is that received?
Yes, that's affirmative.
The patient could have wide-ranging injuries, anything from a serious head wound to spinal or internal damage. All common conditions associated with even a shortfall from height.
So we're looking for a farm. Fairly isolated farms now. Yeah.
Fortunately, the site is less than 2 minutes flight from base.
So I would say this one, according to the map. What do you think? Okay, blue container, somebody in the field. Yeah.
A man spotted propped up against a metal container confirms the team's in the right place.
We'll go to the brown field to start with. Yeah, hop over the hedge. Everybody happy with that? I'm happy with that. It's going to be quite dusty.
An adjacent field provides the perfect landing spot.
Just watch your feet when you go out of sort of ruts. Okay.
Within moments of landing, Alistair and Ali reach the patient, who is with a passerby.
Hi, folks.
All right, guys. Came across you.
All right.
I was walking the dog.
Hi, Neil.
Through the floor, that's okay. Okay.
53-year-old Joyner Neal was carrying out a survey on the first floor of a derelict building when rotten floorboards gave way, and he fell 12 feet onto concrete.
You got any medical problems, Neil? No. On any medications? Asthma. Okay, good lad. Where's it hurting you the most, buddy? Okay. So you managed to walk up to this place? All right.
Neil was just able to get himself out of the building before collapsing. He has a cut to the back of his head and pain across his upper body.
Right, okay. Big breath in for me. Where's that hurting? This side, on the chest?
Yeah.
Okay. In the middle? In the middle? Any pain in the belly? Good lad. Any pain in the hip area? Legs feel all right?
Yeah.
We'll have a look at your back, all right?
Dr. Ali wants to pinpoint exactly where Neil's injuries are.
I might have to cut some of your clothing. I appreciate you're a little bit chilly, chap, but I just need to have a look at what's going on with arms and so on. So,
Right, do you think you could sit forward for us a second? Right, but I'm just going to feel my way down. Pain here? Pain here?
It's to the left side.
Yeah, it's got a lump on the left side, I think in posterior rib.
The worst pain is in the left side of Neil's chest. A visible indentation on his back points to a broken rib, which could have punctured a lung or be causing internal bleeding.
So if you take a big breath for me, is that stopping you? Difficult to breathe in? Okay, well, it's a possible chest pathology.
He needs urgent hospital treatment.
I'm going to stick a little needle in you, chap, and we'll see if we can sort some pain relief out for you.
Alistair is preparing to insert a cannula in his arm so analgesic drugs can be given intravenously and provide the pain relief Neil badly needs.
Are you using all of this arm to support you? Is there any chance I can take the weight off that arm? And just look at popping a little needle in you. If you need to put the arm down, tell me. And you're working here on your own? Yeah.
Hey, buddy, just whilst we're trying to get a line in, yeah? Just have a quick look at your chest, all right? Might be a bit sore, just bear with me.
Sharp scratching your hand, chap, sorry.
Dr. Ali uses an ultrasound monitor to look for signs of a collapsed lung or pneumothorax a life-threatening condition that can be caused by a broken rib puncturing the lung wall.
Take a big breath in for me, buddy. That's fine, well done.
The ultrasound finds no evidence Neil's lung is currently compromised, but it could still happen at any moment.
Hi guys, you alright?
Ali updates an ambulance crew who've just arrived.
So we've fallen from the first floor inside. He's basically going to land what looks like on the left back and head. Not knocked unconscious. He's managed to come and find his way out here. The main pain he's complaining about is left chest, shoulder and back. And looking at it, you can see it looks like some sort of indentation. And he says he feels a bit sort of like tight in breathing, but we've done a quick ultrasound, can't see any pneumothorax. So I think it just looks like ribs and maybe back for now. He has got a head injury.
The nearest major trauma centre is 20 miles away. And with Neil's injuries, it's quicker to fly the patient than transport him by road.
Oh, please, yeah.
It's penetrated a little bit. It's like the heel at the back. Can't see any contact or anything like that.
While the ambulance crew dress Neil's head wound,
It's going to sting it just slightly, okay? We're just going to cover it up.
So three, quick update for this gent then is
Alistair calls the trauma desk to let them know the plan.
he's fallen probably 12 feet unwitnessed, got a deformity to left rear of back plus and minus a shoulder injury and a laceration on the head. With a chest wall deformity, we're thinking up to Stoke and we'll probably fly him over.
Roger, that's received. Thanks for the picture.
No worries, it's going to take us a few minutes to get pain relief sorted before we can move across into heli and so on. So as soon as we're sort of loaded in heli, we'll give you a proper shout over.
All right, buddy, painkillers coming up.
Dr. Ali administers morphine to get Neil's pain under control before they attempt to move him.
All right, here, Neil, just going to give you some of the good stuff. How are you feeling now? A bit woozy? In your legs? All right, buddy, don't worry about that. I can't give you any more now because you're sat up. I don't want you to fall over. Just as soon as we get you lifted. Feeling any better? Yeah, good.
Neil is now ready to be taken to the helicopter.
There's going to be an issue of lying flat on here with the back pain.
Yeah.
It's not going to be straightforward.
He's been like this the whole time.
Okay.
I'm just thinking. Let's have a feel of the back now. Just going to have a press of the back, Neil. I don't think we're going to be able to lie down flat.
Okay.
It's going to be the issue.
Lying Neil flat on a stretcher is likely to cause him too much pain.
Because, I mean, I've given a decent amount of analgesia, but we're very, very tender.
Okay.
How are we going to get him across from the trolley?
A trolley bed would be more comfortable, but couldn't be wheeled through the ploughed field.
Going to have to carry, probably.
Or carry chair?
We could do a carry chair sitting,
Yeah.
but then moving him or flying him, sitting up is going to be awkward.
Yeah.
Only other thought is we walk to the helicopter.
No. Shall we try that, Neil? Walk you to the heli?
Getting patients with traumatic head injuries up onto their feet is usually avoided. But in certain circumstances, it's the best option.
All right, Neil, let's just stand you up and see what you like on your feet. Because if we are going to walk you, we can walk you to the scoop. All right, Neil. Now, I know this arm's a sore one, but I'll just give you a little bit of support by grabbing your trousers. Let's go, nice and slow. Good lad. That's the one. Gotcha. Giving you some medicine that's going to make your blood pressure drop a bit. Just take it nice and steady. Let's just get you laying down here then, because that's the way we're going to transport you. Neil, we're going to lie you down onto the scoop and then take you back nice and slow, all right?
No.
We've got you, I promise.
I'm gonna fall.
No, you won't.
Oh, yeah, that's it. Relax back. Yeah,
All right, there you go. Good lad.
Once on the scoop, Dr. Ali can give him more pain relief.
Yeah, some more painkillers coming in. Well done, buddy. How you doing, Neil? That better now? Good lad.
Among Neil's injuries is a suspected broken rib, which could puncture his lung at any moment.
Do you want to hold that? Sorry. Fiddle out, maybe.
Neil, you okay, buddy? Just open your eyes for us. Good lad. That's fine. Well done.
Now prepped for the journey, Neil can be safely transferred into the helicopter.
So one either end, and we're heading for this side of the helicopter, but at the back. where we need the feet towards the tail, and he'll go in head first.
Okay.
Okay, right. Ready, steady, lift.
Bystanders have helpfully dismantled part of the fence to make life easier. But there's still a ploughed field to negotiate.
You okay, Neil? Good lad. Just 2 minutes of this, all right? Coming up to the big rut. Just going over the rut.
Okay. Just nice and steady. Okay. Does anybody need to reposition? Are we happy? Okay, so we're in the rut, hopefully, or on top of it.
Neil is positioned head first into the aircraft, so Dr. Ali can provide critical care en route.
Adjust again. Everybody happy? There's going to be a bit of a lift now.
1, 2, 3.
It's another half a foot. 1, 2, 3, and stop. Perfect.
Lovely.
03 receiving.
Before setting off, Dr. Ali gives the trauma desk another update on Neil's condition.
So we've got a male fallen approximately from first story, landing on left rear chest. Injuries-wise, he's got a head injury to the left occiput, possible chest injuries with maybe a underlying pneumothorax.
All received, thank you.
Thanks very much. Any changes, we'll give you a bell from the air. You okay, Neil? Give us a thumbs up now. That's the one. Good lad. I know what to look out for now. Very loud and very shaky, okay? All right, Neil, there's going to be a start-up.
Neil's destination is the Royal Stoke University Hospital. By road, the journey would have taken 40 minutes. By air, it's just 15. Here, Neil is handed over to the emergency department for urgent scans to discover the full extent of his injuries. As a major trauma centre, all specialists are on hand for any treatment he may need.
Ambulance service, is the patient breathing?
I don't know, just reduced an accident.
What type of, is it a road traffic accident?
Yeah.
I'm sorry, what's actually happened?
I don't know, I was right in the back and I just heard a crash.
Ambulance service, is the patient breathing?
I'm not sure, we just heard the bump and we've gone running down and there's somebody on the floor.
Okay, is the patient breathing and awake?
I don't know, they've just sent me to run back.
Okay, so is it cars?
No, it's cars and pedestrians.
Initial reports that we got on this are there are 2 pedestrian patients, peri-arrest.
It's Saturday afternoon, and critical care paramedics Alistair McNeil and Richard Apps are on shift.
Okay.
Their specialist knowledge and equipment is the reason why they get sent to some of the most serious medical emergencies across the West Midlands.
So we're heading to an RTC in Wolverhampton area, reported as 2 pedestrians that are peri-arrest, and we're probably about 10 to 15 minutes out.
Peri-arrest is when a patient's body is in a highly unstable condition and they're in danger of going into a cardiac arrest at any moment. Multiple emergency services are on their way.
The latest update on the radio is that we have 2 helimed en route, both with doctors, so the potential injuries are significant. Whiskey Romeo 7062. Is there any information on patients' conditions at all?
Patient number 1 is a female, early 20s, potential head injury, quite agitated, and an injury to her right arm. And then patient number 2, male in his 20s, same head injury with agitation. He's got lacerations to his chest and back, and he's got a partial amputation of his right wrist.
Whiskey Romeo 7062, we're approximately 1 minute from the scene.
Thank
The accident's taken place on a residential street. When Rich and Alistair arrive, 3 ambulances are already there, as well as the first of the air ambulance crews.
You have that lady there.
Right.
And then we'll put this one with the aircraft crew.
While the Helimed team focus on the male patient who's already in an ambulance, Rich and Alistair turn their attention to the female.
Hi all.
Oh, electric scooter.
Both occupants of the scooter.
Right.
19-year-old Shante had been riding with her boyfriend on an e-scooter when they collided with a car. Neither were wearing helmets. Shante struck her head in the impact and has also sustained injuries to her legs and arm.
What have we got so far?
No obvious C-spine, spinal pain, injury. Says she can't feel her legs, but she's moving. Blood pressure did drop a minute ago, but that's stabilised at the moment. Keeps going between agitated, unresponsive. At the moment, she's calm, she can hear us.
Yeah. GCS?
GCS.
Rough or AVPO?
It's kind of 15.
She's talking to you?
Yeah.
Although she's now conscious, Shantae's condition is critical.
And blood is coming from, do we know?
Mouth, we've got a wound to the mouth, wound to the ear, big wound to the left arm, quite a nasty wound to this elbow, possibly down to the bone, as best we could see.
Okay. Finish flushing your cannula. Let's get her on the stretcher on the back of the truck, and then we'll have more space.
Shante had been riding with her boyfriend on an e-scooter when they collided with a car. Neither were wearing protective clothing.
So at the moment we've got 2 patients with critical injuries, unfortunately, and significant damage from head-on into a car by the looks of it, which is a shame. Electric scooters as well, unfortunately, so no helmets that anybody's wearing.
While a Helimed team leads the treatment of her boyfriend, Rich and Alistair are focusing on Shante.
Can we get the oxygen back on, or was she not?
She threw it off a minute ago, yeah.
Let's just put this oxygen mask on you.
She has injuries to her legs and mouth and a deep cut on her elbow.
You happy there's enough of us to lift without straps?
It's got one on in
One on, that'll do us, won't it?
Rich and Alistair want to get her into the ambulance as quickly as possible.
Okay, don't worry too much about her head. If she's, just tell her to keep it still for now.
Happy that we've got enough hold. Up.
Just get rid of the... Okay.
We're going to get you onto the ambulance.
Get her to keep her head still.
As a result of her head injury, Shante is confused and tells the paramedics her name is Charlene.
Charlene, can you just ask her to squeeze my hands, mate?
Will you just squeeze the gentleman's hands for us, Charlene?
Yeah, so obeying commands.
Charlene, you're sorry for me. That's better. Keep talking to us, sweetheart, yeah?
Shantae's conscious, but in a lot of pain.
Really important. I know it hurts.
While Shantae's cuts and lacerations are clear to see, it's the possibility of internal injuries that's giving Rich and Alistair cause for concern.
Charlene, what's hurting?
The second doctor-led Helimed team has arrived to help.
Have we had any treatment? No, checks, nothing?
She hasn't checked yet.
Literally, we haven't got IV yet.
Got a vein this side. Charlene, keep your arm still for me.
Where were your tourniquets?
I will need a tourniquet, but just press the BP cuff.
Alistair inserts a cannula into Shantae's arm, so the doctor will be able to give drugs intravenously.
I'm going to need a bit of gauze here. Sorry, mate. 10 mil flush, very nicely. Lovely.
You did a BM?
Don't think anybody will have done a BM yet.
The BM kit measures a patient's blood sugar levels. It's used to help build a picture of their overall condition.
Sorry. Where are we?
BP is on cycle, guys.
OK, we've got 9.4 as a blood sugar, people. And a BP is 97/48.
She's quite a slight lady, isn't she?
Yeah. Cannula that I've just flushed for you.
Right,
fluids are ready to run.
With Shante now prepped for the journey to hospital, Rich and Alistair hand over to the Helimed team.
Anything else you want, guys, before we dismiss? Or do you just want to do stuff on the way?
Yeah, come on, by the actors, then we'll start rolling.
Yeah.
As the helicopter had to land some distance away, it's decided the quickest option is by road.
Thanks very much.
Okay, see you guys.
Ambulance service, is the patient breathing?
Yes.
Is the patient conscious and awake?
Yes.
And what's the reason for the call, please?
Broken leg.
What's the address of the emergency?
We're in the graveyard in rollercoaster.
And you're actually in the cemetery?
Yeah. Below the willow tree. She's feeling quite faint. She's literally about to pass out. She's passing out right now.
Okay, is she unconscious now?
Yeah.
Is she extremely pale? Any blue or grey tinges around the mouth?
Yes. It's very white. Yeah, definitely very white.
We've got an ambulance coming out to you on blues and twos now, and I'm going to stop on the phone with you until they arrive.
A woman has lost consciousness after falling from a tree and hurting her leg. An ambulance crew is already on its way, but because advanced medical skills may be needed, the critical care team have been dispatched.
We're going to a 26-year-old female patient who has apparently fallen and is possibly unconscious and not responding.
Any fall from height can result in life-changing injuries. The fact that this patient has lost consciousness is a major cause for concern and could indicate a traumatic head injury.
Oh, there's the crew. I reckon we can park it here. Okay. Have a wander.
At the cemetery, the ambulance is easy enough to find.
Give us a clue.
But the graveyard is huge, and there's no sign of the crew or the patient.
Not an hour.
As she could be in danger, Jack and Sam must locate her fast.
Ah, visual. Has she jumped off here?
No.
We'll come down.
The 26-year-old woman was trying to climb a tree after a night out when she fell, badly hurting her ankle. Her friend was with her and dialed 999.
Hi there.
Are you all right?
Hi.
She's probably down here.
Yeah. So not falling too far.
No.
The woman's now regained consciousness. The ambulance crew have checked her over and don't think she has a head injury. It appears she fainted from the shock and pain.
Fallen awkwardly, and she just says left leg just sort of come this way.
Hi, underneath. Fine. Okay. Hi, my name's Jack. I'm one of the critical care paramedics from Midlands Air Ambulance. Do you have any pain up here? No. I'm not even going to touch this till we can get your shoe off. And where's most of the pain? Obviously around here, yeah? And have you been able to put any weight through it at all since? Okay, so I think that's fairly obvious, isn't it? You've broken that.
Yeah, I saw it bend that way.
Can you wiggle your toes?
No.
Jack confirms the woman has broken her ankle.
So what we need to do, if we can get chair, blankets, large splints, we'll get some access, we'll give her some pain relief.
The injury will need to be treated in hospital.
So the plan is we're going to obviously get you out of here. It's pretty cold, pretty miserable place to be sat with a broken foot. In the meantime, just some general obs. If you're okay with us putting a little needle in the back of your hand so we can give you some strong pain relief. We'll get this shoe off to have a proper look at your foot.
Before they move the patient, Jack and Sam want to take a closer look at the injury.
Can I have a little look at this arm? Put this round your arm.
Sam prepares to cannulate so that pain relief can be given intravenously.
We've got her heart rate, we've got everything. Are you allergic to any medications? No? Okay.
Jack checks it's safe to do so.
Any alcohol or drugs or anything overnight? Yes. Both or just alcohol? Fine.
Sharp scratch in your arm, all right?
Nice and still.
We'll get you some pain relief now, all right?
With the cannula in, Jack administers a dose of morphine.
It's a very strong painkiller. It can, sometimes when it goes in, it can feel a bit itchy or hot as it comes up your arm. If it starts to make you feel sick or horrible, we can reverse it, or we can give you something for the sickness, OK? But at the moment, it's just most important that we get your pain sorted, OK? That's 4 milligrams now. At some point, we are going to have to start thinking about how we're going to move you and get that shoe off, and it is going to be uncomfortable, but we are going to dose you as we go.
Even with morphine, Removing the woman's shoe will be extremely painful.
Can we set the gas and air up as well?
Yeah, and the IV paracetamol can go up as well. It'll go in over the top of the morphine. And then what we're going to do is I'm going to hold your leg nice and still, and Sam's going to gently bring your shoe off and your sock. How are you feeling with that morphine? Any change?
I mean, I can't really...
Sorry. Yeah, you have, I think, ankle and tib fib, because that is very floppy.
Yeah.
Feel me touching here?
Yeah. Yeah.
The young woman has suffered multiple broken bones.
It looks like it's a fairly straightforward fracture, though. You've got a fracture, well, maybe 3. Fracture of the ankle, and then a fracture of your tib and your fib.
Sam and Jack must now protect her leg with a vacuum splint.
Sorry, sweetheart, I just want to give that stability there. Well done. It is cold, yeah. A bit more, yeah. Happy? It's more stable than it was. That is well splinted now, so that your leg won't move in the way that was painful before. We're going to give you some more morphine, because we're going to start moving you now.
With her leg now stabilised, the patient can be moved to the ambulance.
If I come under your arm, you hold onto my arm. Okay. Bend that good leg. And ready to push? Okay. On your call, then.
Yeah.
Just hop.
Am I hopping it? Am I hopping it?
Yeah. Keep coming back. And can you push yourself back a little bit more? In fact, before you do that, let me get this blanket around you. So, arms in, just careful with that cannula.
Oh.
Are you okay?
The young woman is strapped into a carry chair. Yeah. It's a team effort to lift her up and out of the cemetery.
3,
Step.
2,
Together. Step.
1.
Together. Step.
Flat.
Together.
Once in the ambulance, Jack and Sam can hand over to the crew, who will take her to Sandwell Hospital for x-rays and treatment of her broken bones.
Considering the injuries that she's got, she was in pretty good spirits. And I think the alcohol she had on board probably helped. She works in a bar, and obviously they've had a good night. They've come into the graveyard and she felt they climbed a tree, and I think sadly the choice of footwear probably hasn't helped her. And as she's fallen out of the tree, decent pain relief makes a big difference in these types of injuries. They are very painful. She's got multiple breaks, multiple bone ends pushing against each other.
Ambulance services, the patient breathing?
Yes, he's breathing. He fell off some scaffolding.
Okay, how old is the patient?
He's 74. He's gone very pale.
Okay. The emergency ambulance has been arranged.
Back injuries are among the most common major traumas and can be life-changing. It's estimated that every 4 hours, someone in the UK is paralysed from damage to their spine. With a chance he could be seriously injured, critical care paramedics Steve and Mitch Mitchell and clinical team mentor Ben Reen are dispatched.
We are going to a 74-year-old who has fallen off some scaffolding boards, approximately 12 foot height, and apparently landed flat on his back. He's complaining of back pain and arm pain. So the risk is that he's got a spinal injury, really. His age brings something into that as well. Any pre-existing medical conditions like osteoporosis, brittle bones make a big difference.
Ben and Mitch are first on scene and find the man in his front garden.
Hi there.
What's your name, sir?
Paul.
Paul. I'm Steve and this is Ben. How old are you, if you don't mind me asking?
74.
74.
Paul had been trying to repair some rotten wood on his house when the scaffold tower he was standing on gave way.
You look like you're in a bit of pain there.
Yeah. I got a nasty gash on the thing.
Yeah. And where's the majority of your pain?
Across my back and in the hip.
And with regards to the pain in your hip, is it on the same side as your back? Or is it the other side? Left hip, OK. I'm just going to have a quick look at your back and left, OK.
Whilst we're doing that, can you tell us what happened?
Yeah. I was on the platform up there.
Stood up?
Yeah. Stabilising it all out. And for some unknown reason, it just started to go that way.
Yeah.
Twisted around, and I fell onto that bar on the dock.
Were you knocked out at all?
No, luckily.
Good.
Yeah.
Save that.
Bloody hell. No,
All right, pop your blood pressure cuff on there.
Where possible, the advice after a fall like Paul's is to stay still, because moving can cause injuries to worsen.
The reason I got up was because they were worried these planks might fall off on me.
Okay, gotcha.
Fearful of the scaffold boards falling, Paul's wife and some nearby workmen moved him to safety.
When they assisted you up, did you move anything by his own means, or?
Not a lot, no.
No, okay.
Mitch and Ben decide to leave him sitting.
You're fine as you are. We'll work around you.
Okay.
All right.
Are you short of breath at all?
No, it's painful to breathe in.
Just painful, okay. You might have done something with your ribs at the back. Can you try and push down on your leg as if you're going to get up, but I don't want you to get up like that, okay. Right, we'll get you a little bit of oxygen and I'll just go and get some painkillers out of the car, okay?
Thank you.
All right.
The pain in Paul's chest points to a fractured rib.
Pop this on.
Is he normally quite a pale complexion?
Yeah, he's pale, but he's got
Yeah.
paler than normal.
Mitch calls the control room to request an ambulance.
Could do with an ambulance. Patient's got shortness of breath from pain along ribs.
A spinal injury also can't be ruled out.
Would you like that as a red or an amber backup, over?
I'd probably put it as a red. What were you trying to do then?
All the wood's rotten. I was going to replace that.
Yeah.
And then paint the house.
Paul is in a lot of pain. He needs a scan to determine whether he has broken any ribs and to make sure he hasn't damaged his spine.
Did you want to do cannula and stuff like that? Yeah, it sounds.
While they wait for an ambulance, Ben and Mitch are doing everything they can to make him more comfortable.
This arm's not sore, is it?
No,
all right.
Only below the elbow.
I'm going to pop a needle in one of these veins and we'll get some pain relief in, all right?
Okay.
All right, little scratch coming up, okay?
Yeah.
Ben inserts a cannula into Paul's arm so that painkillers can be administered straight into the blood.
Are you allergic to anything at all?
No.
Have you had any paracetamol at all?
No.
Okay. It's paracetamol.
Lovely. Thank you.
Got that going.
Although it's just paracetamol, it works really well, actually, through the vein.
Yeah.
It should be a bit quicker for you.
Out of 10, how bad would you say the pain is? 10 being really bad.
Oh, no.
Pardon?
A red 7.
Although Paul's putting a brave face on it, he's still in agony.
Ever had morphine before?
No.
No.
Morphine sulfate, 10 milligrams 1 ml, 223.
Is that easing off a little bit there?
Yeah. No, it's only when I pass it up I'll get the time.
Okay.
Finally, the pain is beginning to subside.
We're just waiting on the ambulance now, all right?
Yeah.
Paul will be taken to the nearest hospital, where he'll be x-rayed to find out exactly what damage he's done.
Hiya.
I don't think he's going to be able to move too far, so I think if we bring the stretcher light right up next to him, stop there a sec, I think come back a bit, that's it.
Are you all right there?
Yeah, perfect.
As they are confident his injury doesn't involve the spinal cord, Ben and Mitch help Paul to get himself onto the stretcher.
Brilliant work. Well done, Paul. So your head goes that end,
Going up this way.
and then we'll bring your
Hold
feet
your
up.
back if you've got the legs.
Okay. Keep your feet together, keep your feet together, that's it.
Will he have to stay in?
We don't know. It's completely up to the doctors and what they see and what they find.
He was clearly in a lot of pain and he may have some rib fractures. Hopefully he hasn't done anything to his lung or anything like underneath.
Ambulance service, is the patient breathing?
He is breathing, yeah. I'm not
Okay, bear with me. Is he awake?
I don't know. He looks unconscious to me, but he's
What
breathing.
happened?
A car hit him. He's a chap on a bike.
Is he able to speak at all?
No.
No. Are you next? He's unconscious.
Yeah.
Every year, more than 4,000 cyclists are seriously injured on Britain's roads. Many suffer life-changing injuries. Will and Dr. Mark are dispatched.
603, lifting crossing at 1421, heading towards Shipnell. We're going to need 1424 take over.
603, that's received. You go to the car versus push bike, 35 miles per hour.
An ambulance crew is treating the patient, but is asking for further assistance.
Patient has some pelvic pain, neck and back pain, and it could consider he's got a respiratory rate between 30 and 36. No obvious chest injury on their examination.
The accident's taken place near a junction on a main road.
They can't see any houses or no wires crossing that field.
The Helimed crew quickly identify a nearby field where they can land.
Landing.
All right. Hi, all right, hello. Hello, sir, all right.
Hiya.
What's your name?
Ian.
Ian, my name's Will.
38-year-old IT analyst Ian was crossing a junction when a car turned right suddenly, crashing into him. The ambulance crew found Ian lying in the road, unable to get up.
Main injury for us is the neck.
Dr. Mark receives an update on his condition.
Sharp, very tender pain to lower neck, upper back. That's why I called you earlier.
Okay.
He has had 1 gram IV paracetamol.
Breathing-wise?
Breathing-wise, respiratory rate has calmed down. When we first got here, it was about 38.
Right.
As you see now, we're feeling about 20, 28.
Dr. Mark and Will have been called because there's a risk Ian's broken his neck, a serious injury that can lead to paralysis or even death.
Try not to move your head. I think you're doing quite well there, aren't you? How's that collar feeling on you at the moment?
It's a bit uncomfortable.
The ambulance crew have fitted a cervical collar to stop Ian moving his neck and potentially causing more damage to his spine.
So where are you hurting?
Top of my head to sort of top of my back, underneath, you know, like sort of bottom of your neck, top of your back.
Yeah.
That was.
And is that quite central, or is it onto one side at all?
Kind of slightly to the left.
Of your spine?
Yeah.
Okay.
Yeah.
All right then.
Like that really hurt when they started touching it.
Okay.
While Will assesses the patient,
It's a pretty impressive impact.
Dr. Mark examines the car. The extent of the damage may provide clues as to which part of Ian's body took the full force of the impact.
Did you see the video, Doctor? We took the dash cam out and put it in
The police have retrieved footage from the driver's dash cam, a valuable tool to help Mark assess the seriousness of Ian's injuries.
You should see the cyclist just coming down there.
Okay.
By reviewing the footage, it appears Ian's neck and upper back collided with the car, but Dr. Mark and Will also need to look for internal injuries that may not be obvious.
All right, can you take a deep breath in for us? Okay, and back out. Lovely stuff. Any pain when you breathe in?
Sort of I kind of like the middle of my back.
Is there anything on the outside of your hips that pain-wise that you're feeling?
No, that seems okay.
I'm just gonna run my hand sort of down your thigh here. Is that all right? Yeah. Any pains there?
Not quite.
No. And then if I do exactly the same on this side, okay?
Yeah, it's not excruciating pain, but it does hurt.
Right, on top, okay.
Will wants to be sure Ian hasn't fractured his pelvis, a common injury in high-impact collisions that can cause severe internal bleeding and is extremely dangerous.
Do we think that you're able to bring these legs together? Is that manageable for you?
I can't move the left one. I can't move the left leg.
And is that because of the pain?
It's almost like there, my leg's like super heavy.
Don't force it, don't force it. I'll just give you a little bit of a hand. So you're helping me there, aren't you?
Yeah, a little bit, yeah.
Lovely.
It's definitely easier with you doing that.
Yeah, cool. Okay, mate. And we'll just bring this right one back in. Okay. It's not pelvic. It doesn't look like pelvic. It doesn't sound like pelvic. I think low suspicion for pelvic injury, given how he's presenting and everything he's got. Nothing neurological. So the worst of his injuries, I think, is the sort of back pain. It says it's lateral. It's not really central. And then he's complaining of sort of thigh, more groin thigh.
I guess he's come onto that windscreen with his chest and upper body and here quite, hasn't he?
Yeah.
Yeah. We'll help get onto the scoop and then go from there.
Yeah.
Will and Mark need to move Ian slowly and carefully onto a stretcher and into the back of the ambulance.
So what we're going to do, sir, is just roll you ever so gently towards me on this side, and then we're going to put a little plastic scoop under you there, OK?
It's going to be 1, 2, 3, roll, all right?
Yeah.
1, 2, 3, roll.
Lovely. OK, and back. OK.
The same again.
Yep.
1, 2, 3.
Oh.
Where was that?
That was like...
And back.
And that...
Top of my back.
OK.
And what we do now is we fasten your head down, all right?
OK.
2 at the top, 2 at the bottom. On lift. Ready, set, lift. OK. OK, feeling a bit warmer now, Ian?
Yeah, feeling a bit better now.
OK, cool. Good job you're wearing a helmet, right?
Oh, yeah.
Ian, I think at the moment, our plan is to send you up to Shrewsbury, OK, because that's the trauma unit for this area.
OK.
And you get scanned there, and you get your wounds treated, and then they can diagnose you from there. All right. Okay. The main thing is you're awake, you're moving all your arms and legs, OK. And your all numbers are good. There's no huge concerns from us at the moment, but we've always had a very big impact, and we need to get you scanned. All right.
Yeah.
Given the nature of Ian's injuries, Mark and Will decide to leave him with the ambulance crew, allowing them to be ready for the next emergency call.
Through to the ambulance, is the patient conscious and breathing?
Somebody's him on the neck.
Do you know if he's breathing?
He's breathing at the moment, yes. He needs the ambulance quick as possible. There's a lot of blood coming out.
Is the blood spurting out?
Yeah.
It is, my love, OK.
Oh, my God.
Just keep pressing on his neck, my love. We're coming as quick as we can.
Oh, God. I've never seen anything like this. It's getting worse.
Just keep the pressure on that bleed, love. You're doing all you can.
Hi guys. I'm Adam. I'm the doctor on Matt. Who's behind you? You okay? Okay. Don't fight. Don't fight.
Adam immediately takes control of the scene, locating and assessing the size and severity of the neck wound.
Can you hear us? Okay.
Right. So quite a lot.
What's wrong with your breathing? Can we get the trolley out?
Okay, guys.
We'll have the trolley out.
He's bleeding heavily and struggling to breathe.
Okay. Big. Adam, can you see down there?
The victim is just 16 years old.
Okay. So we've got one behind me here.
Yeah.
Is there anything at the front of the neck?
Okay. Put a direct on there then.
He's already lost about a litre of blood. The human body contains 5. Adam knows he can't afford to lose much more before he passes out and goes into cardiac arrest.
What's gonna happen now? Listen, what's gonna happen? Don't worry about them. Look at me. What's gonna happen? We're gonna get you onto an ambulance, okay? Let me just see if there's any blood in your mouth. Open your mouth wide. Good lad. Okay.
Pressure from his wound is causing the boy to panic and restricting his breathing.
Just calm your breathing. You're doing absolutely fine. I know it might feel hard where you've been injured. Okay, it's away from your voice box. I know it's scary, okay, but you're doing fine. I'm pushing on the side of your neck.
They need to get him to hospital for emergency surgery to repair the blood vessels in his neck, but moving him risks tearing the wound and sudden catastrophic blood loss.
Not time. Okay. Right. Listen, have you got phlegm at the back? Just spit it out, mate.
Just spit it on the floor. Go on.
Adam needs to keep the boy calm while maintaining a constant life-saving pressure on his neck to stop the bleeding.
Do you feel able to stand, mate?
Yeah.
Okay, right.
Good lad. Yeah, go on.
I'm not going to let go because I need to put that pressure on, okay? Hold on, guys, hold on. I need to keep the pressure on.
Can you get around, mate, to you? So, bump there, that's it. Lay down on the bed.
Okay.
Once on the stretcher, it's now a race against time to get him to hospital.
Right, mate, you okay? Can we have our bag on the back? Yeah. My hands are going to be a bit tied up just to keep that pressure on. So let's get some straps on. How are you doing? All right, well done. Okay. I need to keep to the QE. Yeah, I need to keep my hands on to stop the bleeding, okay? Because you have bled reasonable amount. Any medical history I need to know about? Asthmatic? Sickle cell? No? Are you allergic to anything? Right. Leave a little bit of room for me. That's it. Well done. Good, so a bit brighter in here.
On the ambulance, Adam and Rob can now fully assess the damage the knife has done.
Hi, mate. You're right. He's bled a fair bit of volume and he's still bleeding past my hand, so I need to get a grip on where that's coming from. Tacky 130, active from the back. It's not anywhere major vascular, but it is actively bleeding. Can I have that Celox, so I can see where that's coming from now?
Hold on, Adam.
Using a gauze coated with a blood-clotting agent, Adam manages to stabilise the wound as much as possible to prepare for the journey.
Okay, Rob, do you want to carry on looking at access for me?
Yeah. Give us that arm.
The boy is in such a critical condition, they both need to travel with him, continuing emergency care throughout the 6-mile journey. Arriving at hospital 11 minutes later, Adam delivers his still critically ill patient to the waiting emergency staff.
That's one of the things we are there for. We will just bring some advanced decision-making in terms of which hospital we're going to. We won't go to the nearest hospital. We will travel a little bit further with an unstable patient to get them to the right major trauma centre.
Ambulance service, the patient breathing.
I've got two stabbing. I've got two. Yeah, two stabbing. One of my bitches is passing me.
Sir, listen to me. I don't know if I'm to breathe.
Please help me, man. My bitches are dying, man. Please. Hey guys, so yeah, we got that stabbing at a double stabbing in Wolverhampton. We're running out of channel 81. If you're able to clear and start heading that way, that would be great.
Yeah, send it on us, mate. We're good to go. I'll change over channel now.
Police and ambulance have been dispatched to the nightclub where the attacks have taken place. Reducing the number of deaths from stabbings is one of the critical care team's main objectives. So paramedic Ian Locke and Dr. Ravi Chauhan are also en route.
The fight is still going on at this location, so offenders still on scene, fight going on in the background.
For Ian and Ravi, being called to a stabbing is far from unusual. In the West Midlands, there are around 60 stabbings a week.
Well, so the update from there is there's a large fight and reports of 2 people stabbed. The fight is apparently still ongoing. So.
With the attackers still believed to be on scene, Ian and Ravi wait until the police give them the all clear.
Right, back away, or we're not going nowhere, yeah?
The scene is too dangerous and volatile for our crew to continue filming, but Ravi's body cam keeps recording the unfolding drama.
Cheers, mate. All right, thanks, mate.
Despite the danger to themselves, Ravi and Ian know if they don't treat their patients quickly, they could die.
He's got 2 wounds to his lower back.
Okay, yeah.
There's one with a single to the upper thorax at the back.
Okay.
There.
Buddy, hey, my name's with the ambulance, mate, all right? Just have a little seat for me, just so we can have a look, mate, all right?
A single knife wound can sever a major artery, causing death within 5 minutes.
I'm not blessed, man. I am blessed. Not blessed, man. I'm not blessed. I'm talking here. I'm blessed here. I can walk. I can walk. I'm blessed. I can go home. I'm blessed. I can go home. I'm blessed.
2, there and there.
I know.
Okay.
Just sit here for a second. Just sit here. All right. Just lean forward.
Put a little dressing on your back, all right, mate?
I'm all right, mate.
Yeah, but
No, you're not. You just...
Ian needs to check the first victim to determine whether his wounds are life-threatening.
All right, just relax for us, mate. Okay.
But it's a tense and aggressive situation.
You know what's my mum got you off,
Right, not now, you won't. Not now, buddy. Not now. Just relax. All right.
Just look. Just listen to us. Just sit down. All right. Let us just do what we need to do. All right.
The man has 2 stab wounds and needs hospital attention, but Ian's assessed his life isn't in immediate danger.
You need to go to hospital, mate. You need to go to hospital. All right. You do, mate. You do. Yeah, we're just going to go and look at him, mate.
They move on to find and assess the other victim.
You're right, mate. Okay, fair enough. Yeah. What's happened? So he's been...
Okay, fine. Just take this off for a second, mate.
Whoa, wait there, one.
Huh?
Just 1 second, please.
Yeah, just take the whole thing off.
Yo, who's that?
First aid, the ambulance.
You can't be touching me like that.
Calm down, man. Just relax.
Boss, you can't be touching me like that.
Okay, all right. Calm down.
The wound is close to both heart and left lung. At the very least, there's likely to be internal bleeding.
Just sit back for a second.
I can't.
Yeah, I need to just have a look.
Buddy, let him do his job. He needs to. He's an ambulance, man. He's checking that you've got no other injuries.
All right.
All right?
Are you finding it difficult to breathe?
I can't breathe.
Okay. All right.
I'm sorry.
That's all right. Sorry, I need you to sit back for a second.
Whoa, wait there. No. Boss, it hurts.
Okay, it hurts on this side, yeah?
Hurts.
Okay, take a big breath in.
I ain't trying to baby.
Okay.
The wound may only be an inch wide, but Ravi knows it could have caused significant damage.
Keep that on for a second. You all right walking out?
I don't know.
All right, I'll get you a chair. If you get a chair, mate. He's got a left side. Okay. He's got worsening, like surgical emphysema, starting to swell around his back.
Okay. Ravi suspects the knife has punctured his patient's lung, a potentially fatal condition that could cause respiratory failure.
Listen, what I need you to do, I need you to get into this chair. Right, we need to get into the ambulance quickly. All right. All right. Sit back.
2 stab wounds, here and here, 1 stab wound right arm. Issues, he's been GCS15 throughout, last blood pressure was that, he's had a gram of TXA, he's got IV access there. He needs to go on the back, he needs to go up to QE, I'll get some fluids and keep an eye on him.
Outside, Ian hands over one victim with multiple stab wounds to the ambulance crew.
Should we go with that one?
Both he and Ravi will travel in the other ambulance with the more seriously injured victim.
Ambulance service for patient breathing.
Yeah, well, it's really emergency. He's got a massive wound and he's breathing and I can't stop it. You can see his stomach.
Get a dry dressing or a clean cloth, fold it into a pad and press onto the wound. How old is he?
40.
Can you try and talk to me on the phone? Hello, sir. Where have you been stabbed?
In my belly.
Have you lost enough blood to fill a coffee mug?
Oh, there's blood everywhere.
A knife wound to the abdomen could be a Category 1 emergency. An ambulance is en route, and just as Pete predicted on Payday Friday, so are he and Dr. Richard.
Got reports of a gentleman who's apparently been stabbed or slashed with a Stanley knife in a pub and has extricated himself home.
Now bleeding for over an hour, the volume of blood loss could become life-threatening. As Richard and Pete arrive at the house, our crew is asked to not film inside the property.
It's like a slash. No evidence of any major hemorrhage, and it looks like it's just in the fatty tissue.
The man's wound is superficial, and the local ambulance crew has stemmed the flow of blood loss.
We're going to just load him up and get him gone.
982 Whiskey Romeo, over. They're going to take him to the QE. There's laceration to the torso.
The patient needs hospital treatment, but his injuries are not life-threatening. Richard and Pete leave him in the care of the ambulance crew.
Ambulance service.
Oh, hi, Approach Police here. Can we get your attendance to a stabbing, please?
Oh, dear. Breathe in and awake.
We do believe so, we're not quite sure.
Do we know if it's a male or a female?
I believe it's a female. A female has been attacked by some of the females. She's been with a machete.
Oh, dear.
There's also the mention of a firearm as well. Apparently we've heard 2 gunshots. We've got 12 units en route at the moment with firearms as well.
Nine 8, go ahead.
9, channel 8, please.
Channel 8, received.
With reports of a violent attack in a suburban street, Dr. Jake and Jack are dispatched.
So we've been tasked to a patient who's been attacked by a machete. Quite nasty injuries, machetes. They're a combination of blunt force and sharp instrument trauma. Can cause some quite severe injuries, significant blood loss.
While Jack and Dr. Jake are still a few minutes away, the first paramedics arrive at the scene.
Afterwards, 55, go ahead over. Thank you. Get all involved parties of lead scene. Police are doing an area search. Reporting 2 patients with machete injuries and police are trying to urgently locate. As such, myself and the crew will continue to stand by for a few minutes and then update from police.
Until the area is secured by armed police, all medical teams will have to remain at a safe distance.
Whiskey Romeo from 98. Can you just confirm the RVP, please?
Yeah, it looks like the Topfield Avenue, Toll End Road, over.
Roger, thank you, that's all received.
A rendezvous point is assigned just down the road from the alleged attack. For now, the team must wait in their vehicles.
So, the offenders are unaccounted for. No idea on exact number of casualties or locations. So, if they've made it to run away and we still haven't found them, on balance, hopefully they're all right, with some fairly nasty wounds, but nothing that can't be cleaned up. Hopefully it's not the case that they've been stabbed through the chest, they've run down a dark alley and gone into cardiac arrest.
Hello, both. Right.
Hello.
Hey,
An operational commander arrives to give the team an update.
So we're currently here on Cupfields Avenue, Junction Road. So that car over there, there's a small amount of blood in the front of the car and the footwell and that. Obviously believed that there's been machete attack. We've also got another RTC slightly up the road here, and that's where they're saying there's a patient with slightly reduced at GCS. And then we've got the other one, minor sort of slash wound to the leg, and that's slightly in that direction. So potentially they're all sort of 3 of them are linked.
It now appears that the incident is more complex than first thought.
So this looks like it's potentially one of 3 connected incidents across the general area here. We've got what looks like an assault involving individuals who may have been assaulted with machetes. Close by we've got a road traffic collision which has a vehicle that sounds like it might potentially have been involved in this incident, and we've got the ambulance there dealing with that. We've also got another not too far away that's turned out to be a knee laceration wound, so not requiring of our services, but again may well be connected. Currently the police are doing area searches, armed response officers are waiting to go into a couple of properties. So we're holding here for now to see whether the injured parties from this scene turn up.
Ambulance services to patient freedom.
We've just been...
Okay, what have they been stabbed with, do you know?
A knife.
Okay, is it bleeding heavily?
Yes.
And how old are they?
They're adults.
So where the wounds are?
One's got one in the stomach, one's in the chest, and one's in the stomach. The one's got 2 wounds, losing consciousness.
Even if he's lost a bit, 2 falls of blood?
It's close to.
Okay.
Can you just send an ambulance?
Yeah, it's not delaying any help, sir, okay.
62 Whiskey Romeo.
Is one of the most challenging situations a critical care specialist can face. If an artery has been severed, a patient can bleed to death in minutes.
Been deployed to reports of a double stabbing, 2 patients, one with chest injuries, one with chest and abdominal injuries in a park not too far from the QE, so hopefully it'll be a case of a rapid assessment, major hemorrhage or like, you know, life threat control, and then a rapid extrication. 60, thank you. ETA approximately 3 to 4 minutes.
The critical care team in the West Midlands deal with more than 30 things every week. Reducing the number of deaths is one of the service's main objectives.
Police en route. Field defence on scene.
Roger, that's all copied.
We are having updates soon that these patients are unconscious. Please today. Their ETA was 2 minutes.
Roger, given the severity of their potential condition, I am happy to make scene with a dynamic risk assessment received.
With 2 patients' lives on the line, every second counts.
Updated report from police has come through that they're both unconscious, so potentially this is going to be 2 traumatic cardiac arrests. 60, that's all copy, just pulling up behind 4634 SRMA 559.
On arrival, it's a major incident, with multiple police and ambulance teams already at the address.
Hi, Rob. Yeah. Roger.
2 neighbours have been attacked. Simon, who's outside, was while trying to defend his friend. "41-year-old Matthew, who has collapsed in the stairwell, has been stabbed twice.
Breathe. Go on, deep breath out. Come on, you can.
He is struggling for breath. The stab wounds are close to his lungs, and they are in danger of collapse.
They put chest gel on, I've not looked at wound.
That's fine. Is he on O2? Hi, mate.
He's on O2 from police, not ours.
The wounds have been sealed, but with internal bleeding and potential organ damage, he's at high risk of going into cardiac arrest.
GCS 15, chest seal applied, oxygen on, and we're just going to get him gone and gone. He's got a good chest wound and a good abdominal wound.
All right, we'll put him straight on 463 if the crew are with him. The second crew, I haven't seen this guy's wound yet, but it's abdominal.
I'll have a quick
so I'm going to get this crew to bring their stretcher up, and we'll get this guy's.
If we just load them both and just get them all gone straight off. I'm just going to grab an apron because I'm half PPE'd.
Once in protective PPE, Jack can make a close assessment of the other victim.
Rob, whilst they're dealing with him, I'll just have another look through this guy.
54-year-old Simon has one small but potentially deadly incision.
All right, can I have a little look, sir?
Oh. You okay, mate? You okay?
Okay, good.
You're all right.
It's a bit of bowel, but that looks it looks like there's too much there with lots of vein through it. Potentially that is bowel, but
the stab wound has gone so deep, his bowel is now protruding out of his abdomen.
You okay, mate?
Okay, good.
If his bowel has been cut, he's in grave danger of sepsis, which can lead to organ failure.
So, hello, sir. My name's Jack, okay?
Oh, yeah.
Do you have any pain anywhere else? Have you been hurt anywhere else? Can we get this bag off you? Is that all right? Are you happy? I'm going to get this top off you, mate, okay? Just to check and make sure you've been stabbed anywhere else, all right? Okay, let's have a look in your arms. Nothing in the back. You definitely weren't stabbed anywhere else? No, there's obviously bleeding, there's nothing into the wounds. Fine. Okay, good.
You all right?
Yes, happy for this gentleman on your stretcher. Is that the plan, Rob?
Let's get him, because as soon as he's moved...
Yeah, let's go.
Suddenly, a fight breaks out amongst the bystanders, threatening not just the care of the patients, but the safety of Jack and the ambulance crew.
So I've got no obs on him other than he's got a good pulse. He's looking a bit pale, as you can see. Single isolated wound.
With 2 patients on his hands, Jack decides Simon is in the most stable condition for the ambulance crew to take over.
I've not taken his trousers off. It looks like there may be some bowel there. There's like a nice vein through part of the flesh, so it could be quite fatty, but I'm not prepared to say it's not bowel.
Yeah, no, sir.
All right.
The other victim, Matthew, is still in the stairwell and in more urgent need of Jack's critical care.
I can travel with either. Probably this chest guy. Probably stick with him because he's going to be the sicker guy.
A bit longer, and if there's anything going to go wrong, it's going to be with him.
Yeah.
Okay.
I'm guarding these for their safekeeping. Please do not say anything. Stay there.
With tensions running high, police officers make a cordon to shield the paramedics from harm.
You guys have to get him on, and I'm going to start drawing you up on TXA. Stand by. Life-threatening.
Life-threatening, okay.
Potentially life-changing. Yeah, you get him gone, get him gone.
Get him onto the truck, yeah?
I'll meet you there. Yeah.
So the dog ambulance can take you down to the ambulance.
It's vital Matthew is kept as calm as possible. With 2 deep stab wounds, any rise in blood pressure will increase the speed of blood loss, and he could go into cardiac arrest. With a police dog escort as protection, Matthew is quickly evacuated to the safety of the ambulance.
Let him go now.
Yeah, go on, go. I know, yeah.
Try and get these doors. Yeah, I'm going to get them.
Sorry. 6-2, go ahead. Very disordered scene. Can you pull yourself forward, mate, with my help? Matty, give us a hand. Now push yourself as far back as you can and get yourself sat up nice and high for me. Get your legs planted in, you've got good movement. You're doing really well. I know this is a really distressing time, but we're going to get you through it, all right?
Once on board, Jack gives Matthew a vital injection of tranexamic acid to try and stem the blood loss before updating the trauma desk.
I can't breathe.
So I have got a 41-year-old male. We've got 2 wounds. Okay, 1 non-sucking chest wound to the right anterior and 1 wound to the right lower quadrant.
They will alert the hospital to expect 2 critically injured patients who will need urgent surgery.
He's had TXA oxygen applied. The other patient is on the other vehicle. He has an abdominal wound, potentially a spat of small bowel visible. We are leaving scene now for the QE, ETA approximately 6 minutes.
While travelling on blue light, Jack closely monitors critically ill Matthew.
Is that pain a bit better? Yeah? Feel a bit easier? Good. You able to take a deep breath in for me? And out. Sore on that side? It's all right, I know, I just need this chest seal to stick a bit. Otherwise it's not doing a huge amount. I don't think you damage your heart, I think it's your lung, essentially, or the space where your lung should be, okay? When the call came in to say we had 2 patients, potentially both unconscious, I'm thinking traumatic cardiac arrest, I'm going to have to really prioritise who's going to get my help first. Yeah, just twice. The trick with these patients is get going while the going's good and don't waste time. We're not going to fix their problems on scene. If they arrest on scene, we're in a whole world of trouble.
30 minutes after the emergency call was made, both victims are handed over to the major trauma team at the Queen Elizabeth Hospital, Birmingham.
Either of those wounds could potentially kill someone. The gentleman that I was with, he had air in his chest that was taking up space that lungs should have been taking up, so compromising his ventilation. The other gentleman, if he's nicked his bowel, that can be really quite complicated. Both are going to be at least life-changing and going to require significant recovery.